How embarrassing. I can't believe I forgot it on my first day back. Oh, good morning, Marcus.
Morning. What are you doing out here? Aren't you going in?
I got stopped because I forgot my ID. I told them to call Billy at the reception desk, but he doesn't work here anymore.
Well, it's been 3 years, so I can't say I'm surprised. All right, I'll go straighten things out.
Thanks.
My, you're here early, Dr. Vaughn.
Hey, Dr. Russo. It's been a long time.
Hello, Dr. Blaylock. How was Montgomery Memorial?
Well, it was certainly challenging.
I have to admit, I was quite envious when I heard that you were going. I mean, who wouldn't want a chance to get in touch with nature?
I heard that you became chief surgeon. Congratulations.
Ah, thank you. Of course, that was 6 months ago.
Sorry, I've been a little out of the loop.
Think nothing of it. I understand completely. After all, you were quite far from civilization. Oh, by the way, Professor Wilkins is expecting you to. He's waiting in his office on the 5th floor.
All right, we'll go see him.
I wonder why they asked you to return, seeing as how you've made little progress on your research. This hospital must be busier than I thought. I hope you two live up to your reputations. Well then, if you'll excuse me.
I see he's still as charming as ever.
At least you know what to expect from him. Dr. Wilkins?
Ah, welcome back. I've been waiting for you for quite some time.
Yeah, it took me a while to decide. Have you been bedridden?
This disease can be debilitating, but the symptoms haven't progressed that far just yet. I'm in better spirits than I look. In fact, I even make the rounds occasionally. Of course, that's only for the time being.
What's this disease you're referring to?
Relax, my dear. The symptoms have temporarily subsided. Once I've made the necessary arrangements, I'll explain my situation in greater detail. After all, this is a confidential matter, even within these walls.
It's a secret?
Yes. You could say that I am both a patient as well as a research subject. For now, I'd like you to resume your normal duties. I'm sure Rousseau will find something for you to do.
Yeah, I'm sure he will. Well, we'll get to work then. Call if you need anything.
Marcus, you went against my orders and ran off to Alaska. But in the end, you were forced to return here. I won't reproach you, as long as you accept your fate.
Is that what you want me to do?
Indeed.
Hi, Dr. Blaylock.
Oh, hello, Elena. Are you starting today?
Yes, I am. I actually just returned from a brief vacation.
I need to hurry up and get back into the swing of things here. But it's hard because there are so many new faces.
Valerie, are you in? We've got an operation to perform.
Are you serious?
Russo took the liberty of volunteering us. Nice guy, huh? I have a feeling this is just a taste of what's to come.
All right, I'll go prep. Elena, can you assist?
Definitely. I'll start setting up immediately. Allow me to begin the briefing for today's operation. Well,
Oh, am I making you nervous? Just pretend I'm not here.
Please continue, Elena.
the patient is suffering from a putrefactive lung abscess due to Staphylococcus aureus. Both the X-rays as well as the CAT scan support this diagnosis. You have two objectives for this operation. Look for a shadow using the ultrasound, make an incision, and drain the pus. And of course, excise the tumor that's causing the problem.
Is there anything you'd like to add, Dr. Rousseau?
Oh no, I'll merely be observing.
We'll try not to disappoint you. Ready to begin.
Let's begin. We'll show Dr. Rousseau why we're here.
It's festering. We need to drain the pus.
Otherwise, it could lead to inflammation.
It looks like there's a tumor. I recommend the Powell procedure. It may begin to fester once we need to drain the pus before treating the affected. Doctor, it's becoming inflamed. I think you should inject some anti-inflammatory.
So far, so good. But according to the diagnostics, the affected area may be larger than it appears. We need to use the magnification tool to take a closer look.
Looks like the diagnostics were correct. We've got more work to do.
Well done, Doctor.
The vitals!
Don't forget to treat the affected area.
The vitals!
There's not much time.
That seems to be the last one. His vitals have stabilized. Now let's close him up. Looks like the procedure was a success. Good work, Doctor.
Well, Dr. Vaughn, I see that you haven't allowed yourself to get rusty.
Surprised?
Well, you could have suffered from frostbite. Ah, yes. I must explain our new post-op procedures. Things have changed since you left. The chart needs to be submitted to the clerks on the second floor. And surgeons are required to attend a case review session every Tuesday morning. However, we won't be needing you there just yet. I'll call for you when it's deemed necessary. Well then, excuse me.
Thank you. We'll be implanting a pacemaker?
Yes. You'll be performing an exchange operation to upgrade the one currently inside the patient. You'll also be performing the pre-op examination on her.
Why us and not a cardiologist?
Because I believe you two are better suited to perform the procedure. A team of specialists will be available to assist you, but I doubt that will be necessary.
It seems they're expecting a lot from us, but you wouldn't know it by the way the staff's treated us.
This can be considered as a preparation phase for the actual operation. An appropriate pacemaker has already been selected. You'll be implanting the same type I'm currently using.
The same pacemaker you're using?
Are you sure it's not gonna hurt?
You'll be fast asleep the entire time. It'll be over before you know it.
But what if I wake up? Will it hurt?
I promise that won't happen. The medicine will keep you asleep, no matter what.
If it's gonna keep me asleep, then how will I wake up? Will I sleep forever?
Well, you'll wake up because you'll get hungry.
Chloe, you heard that your heart isn't doing well, right? Right now you're okay because doctors put a machine in you that helps your heart. But we found out that machine isn't working like it should. So if we don't put in a new machine, your chest is going to hurt. You don't want your chest to hurt, do you?
No.
All right then, the operation is going to be tomorrow. Let's both do our best.
Come on, Chloe. Let's go back to your room. Don't worry. There's nothing to be scared about. You'll be all better real soon.
Opening up a child's chest for the second time. As a doctor, I know I shouldn't be faced by it, but it's still heartbreaking.
This operation has nothing to do with the professor's orders. Let's just concentrate on doing our best for that kid.
I'm not lying. It really hurts. Come on, there must be something you can do.
I'm sorry, but we didn't find anything wrong when we examined you.
That medication I used before seemed to help. How about some more of that?
As I said before, I can't write you a prescription. Dr. Vaughn, can you please help me explain to this patient?
Me, Dr. Chen?
He won't listen to reason, and I refuse to write him a prescription. He's just pretending to be in pain because he's addicted to painkillers.
What? Are you calling me a liar? Forget it. I'm out of here.
What does he think this is? A street corner? He was wandering around, so I offered to help him.
How did he get in?
I don't know, but I should report him to By the way, Dr. Vaughn, I heard that you're conducting a pacemaker procedure today.
That's right. Since I'm the new guy, I have no choice but to follow orders.
I suppose that's true. Well, good luck. If all goes well, I'd like to ask you to be my assistant.
I'll do my best to live up to those expectations.
Let's begin the conference for little Chloe.
Please do.
Your objective for this operation is to replace the patient's pacemaker. First, you'll have to stop the old pacemaker. Then, remove it and insert the new one. This operation will require great precision and will put a lot of strain on the patient's body. Please proceed with the utmost care.
Of course. This is a very serious operation.
She's only a child, so even a small mistake could be fatal.
It's true.
Well, good luck, you.
Let's get started.
Today, we'll be
If I remember correctly, it...
Oh, really? Well, let's have a look.
First, we need... Please be careful, Doctor. Okay, good job. Looks like...
Doctor, the patient's going into cardiac arrest.
We can't use the defibrillator because of her pacemaker.
We'll have to massage the heart by hand.
Wait for the hands to overlap, then... That's right, just like that. Thank goodness.
But we can't relax until...
There's a chance she'll go in if that does occur.
Understood. Use the antibiotic gel. Cut the lead attached to... Now that you've cut the lead, hurry up and remove the lead before more... Now, place...
The EKG. Please be careful.
False alarm. Let's continue.
Cut the lead attached to the heart. Okay. Now it looks like you got all the blood. Now, quickly remove... Please place the lead on the tray. Please treat the remaining...
I was worried there for a second. Let's continue the procedure.
Now would you please place the old device on the tray? I'll get the new pacemaker ready. You can place it in the same spot as the old one.
You're putting the patient's life at risk. Step aside.
Old pacemaker was. You can place it in the same spot as the... Next, attach the leads to the device. The first lead is ready. Now, both leads are attached to the device. Now use the ultrasound to find incision points.
Doctor, your timing's off. Wait until the hands are overlapping. Concentrate! Your timing's still off!
Now that you've found the right spot, let's drain the blood before... It may hemorrhage again, so bring the lead all the way to the incision.
I was worried there for a second. Let's continue the procedure.
Let's suture the slit before it hemorrhages again. That's it for this one. Just follow the same steps for the other lead. That's where the second one goes. Please make a small incision. We can't let too much blood... Okay. Ready to insert the lead? Remember to suture this... Huh?
We were almost done, too. All right, let's massage the heart.
Okay, we're almost done. We just need to suture the slit. Well, let's activate the pacemaker.
Good. It's work...
That's great news. So all we need to do is close her up and we'll be finished. Looks like the operation was well done, Doctor. I'll be sure to report the results to the professor.
Chloe, this is called an X-ray. It's a picture of the inside of your chest. This is the machine we put inside you during the operation. It's...
Wow, cool. That's what's inside me?
It runs on electricity, so there are a few things you need to be careful about. Elena will explain the rules to you, so listen carefully, okay?
Did you see it? Isn't it cool?
Yes, it certainly is. But don't get carried away just because you feel better, okay? Now the pacemaker that's inside your chest is like a new friend, and it's going to be with you for the rest of your life.